and welcome to our latest edition of the Top Doctors Health First podcast, where this week we are talking about insomnia. This is a condition that affects an estimated 23 million people in the UK, a figure that has risen significantly since the COVID pandemic. So we're joined today by a leading Milton Keynes and online-based psychologist, Dr. Sue Peacock. So welcome, Dr. Peacock. Could you just tell us a little bit about yourself?
Yeah, hi, I'm Dr. Sue Peacock. I'm a consultant health psychologist. I've been practicing for about 25 years now, and one of my specialisms is insomnia. And the other thing I specialise mostly in would be long-term health conditions and sort of medical type phobias and fears. So yeah, it's good. I love helping people get a good night's sleep.
Yeah, very important, of course. Yeah. Okay, so we're going to go ahead and ask you some questions that that a lot of people kind of ask about insomnia. So could you first of all just tell us what the definition of insomnia is and what causes it?
Well, I'd say that there's lots of definitions of insomnia, but the one I tend to use would be insomnia could be the sort of persistent difficulty. So by persistent, I mean at least 3 nights for about 3 months of difficulty getting to sleep, staying asleep, or waking up too early. But it's despite having that opportunity to sleep. So that's what I would define insomnia as. Of course, we all have nights that we don't sleep well. So insomnia is different to that. I'd say that the top causes, most frequent cause that I tend to see in my clinic would be stress. So people have concerns about their work, their finance, particularly at the minute, their families, or stressful life events such as death or illness of a loved one, or divorce or job losses and things like that. So they tend to be sort of the typical stressors. Then there's things like travel and work schedules, because our circadian rhythms are like our internal clock, and they control our sleep and wake cycle, but they also control our metabolism and our body temperature. So disruptions to all of these things can cause insomnia. So examples of this would be, the classic one is shift work. So either day shifts, night shifts, or probably the worst one, the changing shift patterns.
Yeah.
Or something like long-term jet lag. So if you're traveling across different time zones really quite frequently, that sort of comes in that sort of travel work section. Then there's things like poor sleeping habits. So that's where we have irregular bedtimes or get up times. We don't have a very nice sleep environment. Perhaps we're working in bed, we've taken our laptops to bed, or our tablets or our phones or whatever we're doing, work in bed. And then there's all the sort of the tech stuff, isn't it? The gadgets that have the blue light that emits that blue light that affects our sleep.
Yeah.
Another thing would be sometimes if we eat too much late at night, because sometimes we just get physically too uncomfortable to lie down, and sometimes that causes heartburn, which then keeps us awake. For some people, mental health conditions such as anxiety or post-traumatic stress may disrupt our sleep. Sometimes it's worth looking at medication, because different sorts of medication, for example, pain medications, they contain caffeine, which is obviously a stimulant, so that disrupts our sleep. Different health conditions, so obviously pain or cancer or any kind of health condition that you're worrying about, I'm guessing is going to keep you awake. And then there's the more sort of serious sleep disorders such as sleep apnea, restless leg syndrome, all of those kind of things. If you think you have those kind of things, then it's definitely worth going to speak to your GP.
Yeah.
Other more basic things would be caffeine, alcohol, nicotine. All of those kind of things are a stimulant. So whilst people think they're relaxing, they're actually a stimulant. So they're gonna keep you awake.
Yeah.
Another thing would be age. As we get older, there's a change in our sleep patterns, and the older we get, the more tired we get earlier in the evenings. And so we probably wake up a bit earlier because we still have the same amount of sleep. We just have different sleeping hours as such. So it's taken a bit of getting used to. And also, I guess, there's a change in activity levels. As we get older, we probably do less activity than we used to. And obviously sometimes it leads to changes in health and increased usage of medication to manage those health conditions. So they're the kind of things, they're the sort of general causes of why, we have insomnia.
Sure. Well, it's interesting, and of course, it is something that affects a lot of people for all of the different kinds of reasons that you mentioned. So when suffering with insomnia, why is it difficult to sleep, or even when you're tired? Sometimes if you're feeling tired, but then you can't actually fall asleep. Why is that?
That's an interesting one, isn't it? Because I think sometimes we almost put pressure on ourselves to sleep, don't we?
Mm.
Because I know it's 10:30. That seems to be the most common bedtime when I talk to people about sleep. So it's 10:30. So they think, oh, it's 10:30. I've just watched the news. I'm going to go to bed, kind of thing. And sometimes they go to bed and they're not tired.
Yeah.
They just think it's 10:30. They've got to go to bed, so they can't sleep. And then they can't sleep and they're trying to get to sleep. And because they're not getting to sleep, they're getting a little bit wound up, a little bit anxious because they can't sleep. And then they kind of, when you're anxious, you kind of get into that fight, flight, freeze mode. So that prepares you for action and not for sleep. So you're kind of getting stuck into this anxiety cycle. So the next day, because you haven't slept, you think you're not going to sleep. And so you don't sleep. So
Yeah.
you kind of get stuck in that cycle. So quite often some of the work that I do would be breaking that cycle.
Right. Sure. Okay, yeah, I mean, a lot of people have experienced this, I'm sure, but it becomes more of a problem when it's, as you say, it's a persistent problem. But yeah, I can definitely relate to some of these things that you've mentioned there that I've experienced before. How can insomnia affect your general health and well-being?
Yeah, that's a good question, isn't it? Because I think sleep is a little bit underrated, isn't it? People don't realize how important it is, and
Mm,
if we're busy at work, for example, that's the thing that gets pushed, isn't it? We work late into the night to get our work done at the detriment of our sleep. So persistent insomnia, so long-term insomnia can, this isn't just a few odd nights not sleeping, this is
yeah,
chronic long insomnia.
sure.
They can sort of have an increased risk of medical conditions such as increased blood pressure, a weakened immune system, obesity, heart disease, and interestingly, an increased sensitivity to pain. Also, there's an increased risk of being irritable and a bit grumpy and all of those kind of things. So that
Mm,
kind of affects relationships, whether at home or at work or whatever. Some people get anxious, some people have depression. And then there's also the risk of accidents, because we have an impaired a judgment and an impaired memory, mainly related to daytime sleepiness. And so we have impaired performance not only with driving, for example, but also with our work.
sure.
So they tend to be the things that, the general things that will affect our well-being, without going into detail about every single one of them.
Yeah, yeah, sure. Yeah, I mean, obviously, it's as you say, it's quite interesting the different effects that it can have without having enough sleep. That's yeah. So like when if you see a patient in your clinic, how would you work on curing the insomnia or managing it at least?
For most people, we do CBTI, so cognitive behavior therapy for insomnia, because that is recognised as the first line treatment for insomnia, because there isn't really any health risk associated with the medication of sleeping tablets and all of that kind of thing. Um, it's never as easy as you think it's going to be. It actually
Yeah,
requires quite a lot of hard work on the part of the client, because it is quite hard sometimes.
yeah,
But once you kind of get into it, it gets easier. So the things that we would do would be um, focusing on sort of pinpointing the anxieties people have about sleep and replacing them with more healthier beliefs and attitudes about their sleep. We do quite a lot about sleep education and sleep hygiene. Now, sleep hygiene, I always think, is quite a strange word. It
yeah,
basically means the environment that we sleep in. So
yeah,
we're looking at, what our bedrooms are like. Are they dark enough? Are they cold enough? Are you comfortable? Have you got rid of all the tech out of your bedroom? All of those kind of things. Um, we also look at what's called stimulus control. So this is when we get people to only go to bed when they're tired. So not because it's 10 and everyone else goes to bed 10. You go to bed when they are tired.
Hmm.
It's about developing the association that the bed is for sleep. So sleep and sex only in bed. No work, no reading, no listen to music. It's sleep.
Yeah.
It's about setting a pattern. So it's not necessarily going to bed at the same time. The most important thing is that you get up at the same time. And we also encourage people to, if they can't get to sleep after 15, 20 minutes or so, to get up and do something else, because otherwise you just lay there getting cross and frustrated.
Yeah.
You get anxious, you look at your clock, think, oh God, it's only 10 minutes since I last looked. And then it just winds you up, doesn't it? And then it gets to, like, I know, say your alarm's set for 7 or whatever, and it gets to 5, and you think, oh, I've only got 2 hours to sleep.
Yeah.
And then that just stresses you out and you get more anxious, and then you just don't sleep.
Yeah.
So if you can't sleep, we say get up and do something,
Yeah.
not something particularly energetic, something quite soothing and calming. And we'd also sort of discourage daytime naps. So that's what we do in that kind of stimulus control bit of it. We also do what's called sort of sleep restriction and compression, which is basically about improving the quality and quantity of sleep that you're getting. So we use a lot of sleep diaries to work out how much sleep you're getting, even though you probably feel that you're getting minimal, you're probably getting a little bit more than you think you are. And then we slowly sort of set bedtimes, get up times, and we gradually increase that window that you're in bed asleep. So hopefully you're less likely when you go to bed to lay awake to try and get to sleep. You go to sleep within 10, 15 minutes, like is kind of normal. I hate that word, but you know what I mean?
Yeah.
So yeah. And then we do things like relaxation, breathing exercises, meditation, progressive muscular relaxation, which is basically tension releasing the of different muscle groups in your body. And I tend to add in hypnosis and teach my clients self-hypnosis, because I do hypnotherapy as well.
Sure.
So it's quite a comprehensive package. It's usually over about 6 sessions. I tend to do sort of weekly sessions to start with, and then towards the end, as people are starting to implement these things and seeing a bit of a difference, then we can space the sessions out a little bit towards the end. And then say 3 months, we'll have a little bit of a follow-up to see what's happening.
Yeah. Okay. Well, that sounds good. I mean, it sounds a good way of working on curing or managing at least the insomnia. I don't know if you find that things like watches and things like this that record your sleep and things like this. I've heard different kind of opinions that this could have a negative effect, because it's you're trying to achieve the optimal sleep time. I don't know if you have an opinion about that.
I have a mixed opinion, to be fair. I can see
Yeah.
why people use them, absolutely, and it's always quite intriguing, isn't it, to see what your sleep pattern
Yeah.
is. But what I don't like about them is they don't give you the reason why you're not sleeping, and that's what we need to tackle.
Yeah.
So I see lots of people, they bring in all this data and say, look at these patterns, look at these patterns. Well, great patterns, great for bringing it in, yeah, helpful, but they're not tackling the reason why you're not sleeping. They're just causing you to be more stressed out because you're not sleeping.
Yeah. Yeah.
So yeah, like I said, I have mixed views about them.
Yeah, sure. And so are there any changes to diet or routine that you recommend that can help?
Yeah, there's lots of simple things, but then simple things are sometimes the hardest things to implement, aren't they? Because they
Sure.
almost seem too simple.
Yeah.
So I think routine is important. So a regular, consistent getting up time. Like I said, bedtime isn't too too important. It's the getting up time that's the most important thing. I think if you can in the morning, get out and get some light, because I think light's really important, because it sets the circadian rhythms and all of those kind of biological techniques that work within us. Stay active, I think, is really important. I think if you're not sleeping well, if you're taking medication, check it and see what it contains and see whether it is contributing to your insomnia, because it's surprising, like even, over the counter painkillers some of them have caffeine in, so it's going to
Yeah.
be a stimulant. I would say avoid naps if you can. Limit the amount of caffeine and alcohol you have. I'm not going to ever say don't have any. Have some, but limit it,
Yeah.
and perhaps have it earlier in the day than
Yeah.
don't have it come in a couple of hours before you get into bed. So have it maybe if you're having a glass of wine or two, have it with your dinner kind of thing, rather than just before you go to bed.
Sure.
Again, thinking of that thing, avoid large meals before bed because it's just too uncomfortable to sleep. don't underestimate how important your environment for your bedroom is. So it's, you know, it kind of needs to be a little bit sort of cave-like, in that it needs to be cool, it needs to be dark, it needs to be comfortable. You know, you need to be comfortable. You need to have a nice, you know, comfortable bed, comfortable pillows. You know, quite a lot of the bed shops these days have quite sophisticated sort of recording kind of equipment that you can kind of go and lay on the bed, and it kind of records where the pressure points are and all of those kind of things when you're looking at mattresses. So, you know, spend time doing those things. If you're going to get a new bed, or a new mattress, spend time doing those things. You know, remember, don't just sort of lay there stiff, like, you know, because you feel embarrassed because you're in the shop. Fidget, move around like you probably would, you know, if you're a kid, when you do those kind of things. So fidget, move around, make sure the bed and mattress is comfortable for you. I think almost create a ritual, a routine. So perhaps have a warm bath, do a little bit of reading, perhaps not a really gripping thriller or something that you kind of don't want to put down.
Yeah, you can't put down,
And equally, you know, not a textbook or a workbook. And perhaps listen to some soft music, or do some of the relaxation or self-hypnosis that I've probably taught you. I think the last thing I'd say is, don't force yourself to sleep, because the more you force yourself to sleep, the harder you won't get to sleep. Somebody once said to me, it's sleep is a little bit like a cat. You see a cat and you want to stroke it, but it won't let you, but it will come to you when it's ready. So I think sleep is a little bit
very
like
true.
that.
Yeah. Well, thank you very much. I mean, one of the most surprising things that you said for me is that it's the wake up time that's important. So not to worry about the time that you go to sleep, because I think that is something that people would do, is like worrying, oh, it's late, I'm not going to get enough sleep. But having a consistent wake up time, that's good advice.
Even at the weekend, you know, I know this is hard, but even at the weekends, whilst you're suffering from insomnia, once you've got into that routine and your sleep's improved, then, you know, you can vary it a little bit. And you know, the odd lie-in at the weekend is not going to be the end of the world, you know, because sometimes we need it.
Yeah. Well, thank you very much, Dr. Peacock, for your advice and for explaining more about insomnia. As I mentioned, it's something that affects a lot of people, and I'm sure a lot of people can relate to. Even if it is, you know, not a persistent insomnia, but it's sleepless nights, it's still good advice to tackle that. So yeah, so if you're suffering from insomnia yourself, and you would like to book an appointment with Dr. Peacock, you can visit her profile on the Top Doctors website now. You just searching her name on the homepage, and you can go ahead and book an appointment there. Dr. Peacock does online consultations as well as in clinic, so you know, you have a lot of options there. Well, thank you very much, and we'll speak again next time. Thanks very much.
Thank you very much.